Welcome back to Med Madness, your go-to podcast for all things medical. Today, we're diving into an essential topic for all expectant mothers and healthcare providers: routine prenatal laboratory tests. Understanding these tests is crucial for ensuring a healthy pregnancy and a safe delivery. Let's explore the key tests performed during pregnancy and their significance in monitoring maternal and fetal health. When a woman discovers she is pregnant, one of the first steps is to schedule an initial prenatal visit. During this visit, several important laboratory tests are conducted to establish a baseline of the mother's health and identify any potential risks early on. First, we have the RhD type and antibody screen. This test is essential to determine if there is an Rh incompatibility between the mother and the baby, which could lead to serious complications. Alongside this, hemoglobin, Hematocrit, mean corpuscular volume, MCV, and ferritin levels are measured to assess for anemia and overall blood health. Screening for infections is another critical aspect of the initial visit. Tests for HIV, VDRL, RPR for syphilis, HB-Sag for hepatitis B, and anti-HCV antibody for hepatitis C are conducted to prevent transmission to the baby and ensure appropriate management if any infections are detected. Additionally, immunity to Rubella and Varicella is checked to protect against these potentially harmful infections during pregnancy. A urine culture is performed to screen for urinary tract infections, which are common in pregnancy and can lead to complications if untreated. A urine dipstick for protein is also conducted to screen for conditions like preeclampsia. Depending on risk factors, a Chlamydia PCR test and a Pap test might also be done if indicated for cervical cancer screening. As the pregnancy progresses, additional tests are scheduled. At 24 to 28 weeks, hemoglobin and hematocrit levels are rechecked to monitor for anemia. An antibody screen is repeated for RhD negative mothers to ensure no sensitization has occurred. This is also the time for the 1 hour 50-gram glucose challenge test, which screens for gestational diabetes, a condition that can affect both the mother and baby's health. In the final stretch, between 36 and 38 weeks, a Group B Streptococcus rectovaginal culture is performed. This test identifies bacteria that can be passed to the baby during delivery, and appropriate measures can be taken to prevent transmission. Let's not forget the importance of influenza vaccination. Pregnancy increases the risk of severe flu complications like pneumonia and acute respiratory distress syndrome. Therefore, all pregnant women without contraindications should receive the inactivated influenza vaccine as soon as it becomes available. This vaccine is safe during every trimester and while breastfeeding, providing essential protection for both the mother and the baby. However, the live attenuated intranasal vaccine is contraindicated during pregnancy due to the risk of congenital infection, but remains safe for breastfeeding women. For those at risk of preeclampsia, a baseline 24-hour urine collection for protein is performed during the initial visit. Later in pregnancy, if blood pressure increases, the test is repeated and compared to the baseline to distinguish between chronic hypertension and preeclampsia. Screening for gestational diabetes is a standard practice at 24, 28 weeks gestation, but high-risk patients are screened earlier. The 50-gram 1-hour glucose challenge test is preferred for its higher sensitivity. Routine screening for Trichomonas vaginalis is performed in HIV-infected women due to the high prevalence of the disease. In contrast, asymptomatic HIV-negative pregnant women do not undergo routine screening for T. vaginalis. Wet mount microscopy is used to evaluate vaginitis in symptomatic patients, but is not performed in asymptomatic ones. Flu season brings additional concerns. Influenza infection during pregnancy is associated with increased morbidity and mortality. Therefore, vaccination with the inactivated influenza vaccine is recommended for all pregnant patients. It is safe in every trimester and during breastfeeding, ensuring both maternal and neonatal protection. To illustrate the importance of these tests, let's consider a real-life case. Maria, a 28-year-old woman, came in for her first prenatal visit at 10 weeks of pregnancy. Her RhD screen revealed she was Rh negative, while her husband was Rh positive, prompting her to receive Rh immunoglobulin to prevent complications. Routine blood tests showed mild anemia, for which she was prescribed iron supplements. Her urine culture detected a urinary tract infection, which was treated promptly with antibiotics. At 28 weeks, Maria's glucose challenge test indicated gestational diabetes. With dietary modifications and close monitoring, she managed her blood sugar levels effectively. At 36 weeks, her Group B Streptococcus culture came back positive. Maria was given antibiotics during labour to prevent transmission to her newborn. Throughout her pregnancy, Maria also received the inactivated influenza vaccine, protecting her and her baby from severe flu complications. Thanks to these routine prenatal tests, Maria's pregnancy was monitored closely, and both she and her baby remained healthy. Routine prenatal laboratory tests are a cornerstone of prenatal care, helping to identify and manage potential risks early on. These tests ensure both the mother and baby are closely monitored and cared for throughout the pregnancy journey. Thank you for joining us on Med Madness. Stay tuned for more insights and stories to keep you informed and prepared in your medical practice. Until next time, stay healthy and stay informed.